And what's your vision for your practice and for yourself in chiropractic in the next 10 years?
Well, I I know I don't look it, but I'm 69. I'm gonna retire at 70, but I'll probably continue to do some acupuncture. That's something I'll sort of phase out of. So I have 6 grandchildren. So my bucket list is, they're young. So my dream in life is to pick them up from school and help them with their homework and raise this next generation, help raise this next generation. So
Great goal.
that's
I'm glad we
my
got you when we got you then. If you're retiring next year, I'm glad we had time to talk.
Yeah, well, I'll stay involved in chiropractic, but I have to tell you that at that point, it's I mean, we see over 700 people a week. I just can't keep that pace up much longer. I gotta let the younger doctors take over. That's why I've hired other associates. Yeah, I just can't keep that. I can see it coming. Retire before they kick you out.
That's great. Now you can be Dr. Grandpa.
Yeah, that's my dream, is to do that. So we've already done a lot of traveling, so I've been very blessed to be able to travel a lot. So I don't really have any travel plans, to maybe visit family if that's it. That's about it. So
So with all you do, you don't think you're gonna get bored in retirement?
no, no, now with 6 grandchildren, I don't think I'm gonna be too bored. Plus, I'm probably gonna stay involved in the community, though. I'll probably get on a couple boards and do some work, probably stay I'm involved with the university, so probably stay involved with that. So
That sounds a little more like you. Now that I can buy.
I still wanna do that. One thing I did forget to tell you when you're talking about mentors, I hate to go back to a question. When I was at Northwestern, I took one class and Patch Adam taught the class.
Wow.
And Robin Williams, played him in the movie Patch Adams. Now, if anybody's seen the movie, Robin Williams isn't weird enough to be Patch Adams.
You mean the actual Patch Adams was weirder than that?
Yes.
No kidding.
And I had an opportunity of him as a professor, and we opened up big wing over at one of our hospitals, and I was able to get Patch to come and mentor and talk to our nurses and our docs. And I got to spend a day with him. This is years ago. And then he said, "Well, let's do rounds." So I got to do rounds in the hospital with Patch Adams. And I have to tell you, I learned so much about how to weave humor into the healing part of chiropractic. I have to tell you, it was just being with him was just wonderful. I really enjoyed having some time with him.
I am so happy you remembered that, and I really hope everybody who hears that name will Google who Patch Adams is and at least watch the movie, because what an
Yeah,
incredible story.
it is, and he still runs that in West Virginia. So
Really.
yeah,
That's amazing.
he's the real thing too. He's funny though. I can tell you, but he does it in a he does it in a really diffusing, loving way and a healing way. That's what's so important.
Yeah. Yeah, absolutely. Wow. That's absolutely incredible, and, well, I'm sure, you said, you're that goofy friend. I'm sure you adopted a lot of that from Patch Adams.
Oh, yeah, that's where it probably came from.
He gives you a certain sense of freedom, I hear.
He does, but it really helps people. I send a lot of cards out because I don't think anybody does cards anymore. And I do email people, to encourage them. But I do send, as you know, pop-up cards. And
People
'cause I,
really
I
appreciate those cards.
but I make sure I write a personal, really uplifting note to them. And you'd be surprised how many hurting people there are out there. I mean, your friends and family members, everybody's hurting somewhere. And just to get that to help them get through it. Um, it's
Great
just another
stuff.
way that we can help heal the world.
Yeah, we're in the people business, everybody wants to be treated like they're special, and I think that that's gonna be part of the healing process. I love the saying that the first stage of healing is the presence of the doctor, and when you can feel the doctor loves you and wants to see you happy and healthy and okay, and that's genuine, I think that that's a very powerful motivator to heal.
Hmm.
So
And,
that's really great.
it is, but you also have to do the hard things too. I'm sure everybody's seeing way overweight people right now, and to address that issue in in a in a way of caring that they need. We need to get them on some type of weight loss program. And then some people, some people have so much fat that, they have yeast infections and they really smell bad.
Yeah.
And be able to tell them that because they don't have anybody around them because of that. Because I think because of self-esteem with the fat and also because of the smell, they don't have anybody close. And I think when you as a doctor, addresses that, I mean, that's a hard discussion to have. But to have it once you just establish, you can't do it right away. You got to establish a relationship. And once you've had the relationship and you address it, it's a very healing time that you can make a very big difference. I have a guy that weighed over 500 pounds and we got him down to like 275. It's taken years, but his life is so much better. And he's not going to die of a heart attack now, or high blood pressure problems. So his blood pressure is almost normal. So there's other things you can do as a doctor besides chiropractic. I mean, obviously we help him with his back pain, you know, but to do everything that you can as a doctor to heal somebody. And that's one thing you need to address, some of the hard conversations you have to have.
Yeah. Well, that's what makes it so important to have that close relationship and be serious about the fact that you have another human being there, which you are. And that's great to be able to be so close to somebody where they will take that seriously.
Yeah. Well, and if somebody cares too.
Yeah.
Yeah. I
Yep.
think that's important.
Absolutely. Absolutely. Can't fake that.